Now, the annual World Health Assembly has officially kicked off, with South Africa calling for more funding for African states and collaboration to find a vaccine. Now, this year's assembly will focus on strengthening global coordination against COVID-19. 4.8 million people, as we know, have now been affected by the virus, and multilateralism is in sharp focus at that meeting this year. So I spoke to South Africa's ambassador to the World Health Organization, Nozipho Mxakato-Diseko. Let's take a listen.
Ambassador, thank you very much for your time today on the AM report. This is, of course, unprecedented times for our country and for the world as well. You talk about multilateralism now being at real risk. I mean, we've already seen it, not only now in the present, but in the past weeks, in the past couple of months as well. Most likely we will see major clashes of interests here.
Inevitably, there are clashes of interests, but there's also a recognition that we have to pull together. So much as I said, this is an important assembly of the World Health Organization. What is heartening is that it got off very, very well. So the beginning, we're off onto a good start. We've cleared critical issues that would have, probably under ordinary circumstances, have deadlocked us for a very long time.
So let's talk about China and these calls that have also come on for the past few weeks, these calls to find the origins of COVID-19. We know that Xi Jinping has now said that China will support a review of the pandemic once the pandemic is over, once it's been brought under control. He, though, says it must be impartial. But what is our position on that as a country?
Well, all of the countries have agreed in the resolution that I'm talking about that in the way in which things are done, according to the procedures of the World Health Organization, whenever there is a pandemic, there has to be a review. When we had Ebola, there was a review. When we had SARS, there was a review. In fact, with SARS, it was found that the WHO had been hasty in declaring it a pandemic, leading to states spending a lot of money on what was necessary to respond to. So every time you get a global health event of international proportions, the rules require that there is a review, and that will be held. We've all agreed. The question is, when do you do it? You cannot do it in the middle of a fire. What will you find? And it usually is a response of a review of the response of what we all did.
Difficult for the World Health Organization to determine ahead of a pandemic how serious it will be, isn't it, Ambassador? You just mentioned, in 2009, it declared the H1N1 flu outbreak as a pandemic. That decision was later criticized. Then when we look now in the present and COVID-19, also again, a lot of criticism of how quickly the World Health Organization may have responded, and perhaps how it may
from
have...
one country only.
Yeah.
Criticism from one country that had prior knowledge in December and has had a station in Wuhan. This particular country literally had a station in Wuhan. How a pandemic is declared to be a pandemic is in accordance with rules. The Director General of the World Health Organization must establish a committee of scientists, and he did do that, who then advise him, who look at all the evidence and advise him that we need you to declare this a pandemic. So impatient was he with the committee that it moved with rapid speed to declare COVID-19 a pandemic. We all acted, but there were those that were very slow and in doubt, who also had prior knowledge. This is in a context where our scientists are collaborating on a day-to-day basis, and they can see what is coming. And with this country in particular, it knew a long time ago, had all the scientific evidence, but just thought it would blow away. It hasn't blown away. We now all have to pull together to make sure that we work together to find a vaccine and ensure that this is accessible equitably to all, in particular developing countries,
And of course, Ambassador, you're talking about China.
No, I will leave you to determine which country I'm saying was slow. What we do know, though, is that China acted swiftly once it realized. Remember, China was ahead of all of us. But there is this other particular country that had an observer station in Wuhan.
The United
and knew
States,
what was happening.
Ambassador?
I will not name the country. In multilateral diplomacy, we do not name countries. So the point I'm trying to make is that there are processes of and procedures of the WHO for us to be able to hold it accountable.
Yeah.
But at the end of the day, the WHO is as good as the sum total of its members.
What are the chances of in reality of collaboration when it comes to a vaccine?
There is actually collaboration as we are talking. To my knowledge, there are more than 120 initiatives that involve cross-collaboration by scientists from across the world. What we need to do is to establish the vaccine as a global public good, which our president has already spoken to, so that, like polio, it's accessible, like the vaccine for polio, which has been eradicated, it's accessible easily, not for profit, but for the purposes of treating the pandemic. And that is language also that we've agreed on in the resolution. It'll take collaboration among scientists. There's a group of scientists in the UK that's working with scientists from China. Our scientists are also collaborating with scientists from other parts that in little groups of bright minds that are trying to ensure that we get a vaccine as quickly as possible.
And that's some great analysis there, and probably, not even probably, the most important gathering of the annual World Health Assembly, which kicked off just yesterday.